We know that the second wave is receding. We had a little over 60,000 cases in the last 24 hours. We're way off from our peak of over 4 lakh cases. But third wave fears continue to linger. The Delhi High Court today asked whether the behavior that they are seeing with shoppers thronging the marketplace in the capital is going to bring in the third wave faster. But in the midst of this is a really honest dilemma. So for people who are watching, or for any of us, the question is that if in your city, your town, a restaurant has been opened up, malls are open, bookings are now available at resorts and hotels and on various places. Should you be going to these places? Should you be going if you've had one dose of your vaccine? Should you be going if you've had both your jabs? If so, after how much time is it safe to venture out? Is it okay to socialize in small groups, indoors or outdoors? It can still be confusing even a year and a half after COVID-19 has become a part of our lives. So to speak about some of these things, I'm joined now by Dr. Rajesh Chawla of the Indraprastha Apollo Hospitals. And I'm also speaking with Dr. Srivastava, who's also a member of the Maharashtra COVID Task Force. Welcome to both of you, and thank you so much for speaking with us on the India Development Debate. Dr. Srivastava, let me begin with your take, because let's look at it in the context of Maharashtra. Mumbai is now in level 1, but level 3 restrictions still continue. Clearly, the city is playing it safe, but overall, in the state, it has begun to ease up. Now, what does an average person say? Why not go to the mall if the mall is open? How do you make sure you are safe, and is it safe to do all of these things?
So, first of all, thank you for having me on your show, Tamanna. Is it safe to be going to these places that have opened up? Well, that's going to be human nature. You may restrict yourself. You may actually not do it as frequently as you were doing when there were no restrictions. You may actually do it with a lot of precautions, which is, as we've been talking about, the social distancing and the masking. But you're still going to be venturing out and making those forays into those places which will at least give you a sense of normalcy, that your life is limping back to being a normal kind of a life. So I think that it is human nature. People will go out. People will take the decision to spend at least some time, because otherwise the whole structure of the lockdown has got its own detriments to people's mental health, physical health, the social activities. So I think that what ought to be done is that people ought to be exercising the restraint that comes out of their own minds and doing the things that are required of them, without putting either themselves at risks or others at risks.
Let's be a bit more specific. Dr. Chawla, let me come to you with this question. So, for example, is it safe to socialize in each other's houses? If so, how many people, indoor or outdoor?
There is no restriction if you ask me. But, we have gone through this second wave, and there is, I think, none of us who doesn't know one person who had a mishap in the family or somebody had a great problem. So I think we are not sure how the disease is going to behave. It's looking very good now. The cases have come down, and barely not even 200 cases were noted in Delhi. You are vaccinated, you are protected, but still, I would suggest that people should not only follow the COVID appropriate behavior, like they wear masks, they keep a distance, avoid these social gatherings, because of all this, the second wave spread very fast and it was very bad. And we don't want any wave to be like that. Although a lot of people are vaccinated, there is a chances that even if they get disease, it will be a mild disease. But I would suggest that hold on for some more time. And if you want to visit your elders, please wear masks there for a little more time till the things are more clear and most of the country is vaccinated. That is the time we should socialize. Otherwise, there'll be third wave, there'll be fourth wave, and we'll keep on having these.
Would you concur with that, Dr. Srivastava? So in your view, and because it is a confusing question for a lot of people, is it a clear yes or is it a clear no? Is it safe to go to a restaurant and sit and eat there? If it's indoor, is it safe, or if it's outdoor, is it safe?
It is safe so long as you exercise the restraint and caution that you would do as an average, well-thinking, intelligent person. With the kind of restrictions, there is no government, there is no restaurant, there is no mall that can tell you that these are the restrictions that you must follow. You will need to follow those restrictions yourself. So it is safe so long as you follow those restrictions. Nobody can keep telling you, and nobody can keep an eye on you for 24 hours of the day. But it is important for you to know for yourself as to what is going to be risky behavior. If you end up going to a wedding or a gathering which has got any more than 25 or 30 people, then you're obviously coming into trouble, because we know that the super spreader concept came out of this figure that is any more than 25 people. So if you're going to a wedding which has got, say, 300 people, even if there are multiple halls that you're going to, we've known, we've been in the public health studies that we have looked at, we are aware that this is where it starts, and from here it goes from one small hall to 20,000 people all across that particular geographical area or that society or wherever it is. So I think that nobody can give you a clear rule to say that if you do this, then there is trouble. If you don't do this, then you're safe. You have to know for yourself. You have to exercise it yourself. And more important, if you're seeing people breaking this, then you ought to be talking to them and telling them that this is not in your best interest. This is not in my best interest. Please don't continue with this, and please break this up. So I think it's important to know what is it that you are doing which is wrong. It
Dr.
can't be restricted to one restaurant.
May I ask you, since you are a member of the COVID task force, may I ask you, since you're a member of the COVID task force, don't you think it's time for some clearer guidelines? I mean, people really don't know. Okay, is it okay to go? Let me do a quick rapid round of sorts with you, and I'll do the same with Dr. Chawla as well. So first with Dr. Srivastava. So you're saying restaurant, mall, multiplex, yes or no?
Oh, that's you're asking me to give you a clear yes or no. Well, at this time when the numbers are low, yes, that's okay. Yes. If it turns out that the numbers get to be much higher than this, then it's a no.
Okay. Okay, going to a friend's home or inviting people over, yes or no?
Less than 20 people, yes. More than 20 people in high-risk areas, red spots, hot spots, no.
Okay, going away for a weekend break or booking into a hotel?
At this time, maybe. But if you were to say, look, an emphatic answer, I would have to say yes. But again, it comes back to the same point I'm making. If the numbers get to be much bigger than what we are seeing right now, the answer is a no.
Okay, let me take another set of questions to Dr. Rajesh Chawla. If you've been vaccinated with one dose and you're meeting other people all vaccinated with one dose, how safe would you say that is on a scale of 1 to 10?
You are still not totally safe. So I think you need to follow the COVID appropriate behavior.
And if you've had 2 doses, how long after 2 doses is it safe to be more mobile outside? Would you still need to wear your mask around other people who've also had 2 doses?
You have to wear mask, and the others also have to wear mask. Because we became lax in the first wave, that's how we got such a bad second wave. We must understand that and go slow. Even the lockdown is opening slowly. So we should have these gatherings slowly, go to restaurant, just take a little more time and then go in small. I mean, they are having a 50% occupancy. Go to only those restaurants. Don't arrange parties at home for the time being. Wait for some more time. When most of you are vaccinated, then have a party at home of 20, 25 people. Because we have to go slow. If we are fast, then we will land up very soon. The numbers would rise.
Don't you think, Dr. Chawla, that there is a requirement for clearer guidelines? I mean, I look at it every day and there are visuals of people in crowds. I mean, this is India. Our cities are populated. So even if a small percentage of people come out to an area, it will seem crowded. So there are visuals of people with crowds and then condemnation that, look, nobody has learned their lesson. But if a market is open, people have the signal that it's okay to go to the market. How do we make sure we have very clear, unequivocal guidelines and not leave it on each individual to think of what they feel is right or wrong?
You know, whatever guidelines you make, they're not going to work out. People are indoor for a long time. If they go out, they should go. Again, I said again and again, I'm saying, please don't leave the mask. Please keep a distance. Go to markets where there is a less rush. Don't go to places where there is a more rush. You know, right now, there are very few cases, but the numbers, as you saw in both the waves, multiply in no time. So one has to be extremely careful and slowly, as you know, the vaccination is the only answer. As the more people get vaccinated, things would become safer. So till then, I think COVID appropriate behavior for some more time, few more months, till most of the, at least 50% of the population is vaccinated. It is very difficult to have guidelines because whatever guidelines you make, people are not going to follow unless, I mean, the simpler things, simpler guidelines they would follow. If you make a very complicated guidelines, they are not going to follow.
It's interesting to see what's happening around the world. Singapore, for example, has issued a guideline today where they say you can go to a restaurant, but only 2 people can go. So different nations have followed a different pattern. Some have very established guidelines of how many people at home, indoor, outdoor. It seems to help some populations. Should we have clearer guidelines or not? Write into us, tell us what you think. You know where to find us on our Twitter, Facebook and Instagram. But meanwhile, I want to thank both of you, Dr. Chawla and Dr. Srivastava, for joining us on the first discussion this evening. Stay safe. Let's keep that third wave away. Even if it comes, let's make sure that it doesn't impact us as much.